Hello, welcome to our podcast. My name is Tewari. I'm a gynecologic oncologist, and I'm the director of the Gynecologic Oncology program here at St. Joseph's Medical Center, and specifically the St. Joseph's Center for Cancer Prevention and Treatment. I and my four partners, Drs. Leslie Randall, Dr. Robert Bristow, Dr. Philip Desaya, and Dr. Michael Berman, are listed amongst the top doctors in Orange County for gynecologic cancer care, and we have the honor of being listed in the Best Doctors in America database, which is an honor that you cannot pay to get into, but it is a recognition of our dedication to patient care and the advancement of science in treating women with gynecologic cancers. Here at St. Joseph's Medical Center, our gynecologic oncology program is comprised of four very unique structures. Number one, we have a multidisciplinary treatment planning conference where every patient's cancers are reviewed in a conference with the pathologists, the radiologists, the chemotherapy doctors, radiation oncology doctors, and the OBGYN physicians. In fact, members from all of these disciplines make up our gynecologic oncology program here at St. Joseph's Center for Cancer Prevention and Treatment. We are recognized as both national and international experts in ovarian cancer surgery and robotic surgery for both endometrial and cervical cancer. And as a result, I and my colleagues have received numerous grants over the years from the National Institutes of Health, the National Cancer Institute, biotechnology companies, and pharmaceutical companies to advance new drugs and new surgical devices through clinical trials in patients with gynecologic cancers. Here at St. Joseph's, we are an affiliate of UC Irvine through the Gynecologic Oncology Group. For those of you not familiar with the Gynecologic Oncology Group, this is a cooperative group that's funded by the National Cancer Institute that has been running clinical trials in the United States and internationally for over 40 years. These clinical trials have resulted in many of the drugs that are used today to treat women with endometrial cancer, ovarian cancer, and cervical cancer. We are delighted to be able to bring cancer clinical trials that are Gynecologic Oncology Group trials to St. Joseph's. Another important aspect of our program here at St. Joseph's is our nurse navigator. We have a dedicated nurse navigator, Colleen McGuire, who follows our patients from diagnosis to treatment to recovery and to surveillance and ultimately to cure, and she is revered amongst our patients. We also have a genetics program and a geneticist who can accurately determine whether our patients are at risk for gynecologic cancers through hereditary mutations. Finally, we have a tumor bank, or what we refer to as a biospecimen repository. With patients' permission, we're able to bank tissues here at St. Joseph's to be able to study these tissues to determine which drugs and which targeted therapies may be of benefit to our patients. Through an affiliation with La Amistad, we are able to provide comprehensive, compassionate, and holistic cancer care to the poor and underserved of our community. All of these things make our program a very strong program, and we are delighted to be here. I'd like to now spend a few minutes talking about one of our new approaches. Robotic surgery is a way to perform a minimally invasive operation that is safe and allows for a quick recovery. If you think about hysterectomy is a very common procedure in gynecology and gynecologic oncology. Hysterectomies can be done through an incision, through small holes using laparoscopic equipment, or it can be done robotically. If you think about laparoscopy and robotics together, because they're both minimally invasive, and compare them to open surgery, one big advantage is that patients do not need a long hospitalization. In addition, they recover quicker, and cosmetically, the small little cuts used for laparoscopy and robotic surgery are very small and superior to a long cut done with an open operation. If you now look at robotic surgery compared to laparoscopy, although both of these procedures result in quick recovery and not a long need for hospitalization, robotic surgery is better because the visualization is improved, because everything is three-dimensional, and that makes for a safer operation. Not everyone is going to be a candidate for robotic surgery, but we are amongst the leading experts in robotic surgery, and as a result have been given grants from Intuitive Surgical to study this technology in patients with endometrial and cervical cancer. I'd like to point out that St. Joseph's has 2 SI robots, which are the most advanced robots on the market, and St. Joseph's was the first hospital in Orange County to have a robot for gynecologic and urologic surgery. And that's it for today. We look forward to seeing you in the future.